Amanda with Straightsmile Solutions, straightsmilesolutions.com. Let's talk about gummy smiles, one of my favorite topics. How do you know what kind of gummy smile a gummy smile is, and if it's treatable or not, and how to treat it, and is it an orthodontic problem, a perio problem, or an OMT mouth breathing problem? If you don't identify the etiology of your gummy smile, then you cannot have a good treatment plan to fix the gummy smile. And too many people think that gummy smiles can be fixed orthodontically when often they can't. So yeah, let's dig into it a little bit more. And granted, these aren't the best examples, but I just want to give you some things to think about. First thing is that obviously anytime you see a gummy smile, you should definitely do perio probing, look for signs of plaque, look for signs of infection, look for signs of BOP. If it's like crystal clear, two probes, 1s, 2s, and 3s, no plaque, no BOP, none of that, and it's probably not perio related. So you can check that off if it is. And sometimes it could be more than one thing. If it is, then let's work on cleaning things up. Also, gummy smiles can be due to short clinical crowns. If the anatomy of a crown is short, almost like in this circumstance here, well, then it's going to look gummy. So, I mean, sometimes they can just laser it off or something like that. Now, in terms of orthodontic problems, there is something called vertical maxillary excess. That means that the maxilla has grown, down vertically. Instead of being short, it's long, kind of like in this situation here. Okay, I call this horse smile. It is a genetic thing. Now, this can be modified, as if you do phase 1 treatment, we can definitely mitigate that to prevent, the maxilla from growing in the wrong direction and to prevent vertical growing. It often isn't related to an airway issue as a kid. So if you control the airway issue as a kid, the growth often doesn't happen, but it usually does run in families. So a vertical maxillary excess can be detected on a cephalometric x-ray that requires taking a lateral ceph and sometimes a PA ceph, which is a 90-degree version of a lateral ceph. I have a lot of content about this in my channel if you want to look up any of these big keywords. Getting numbers. You can even, if you really want to know, you can send it to something like Beam Raiders and they can take the whole CBCT file and evaluate it for VME, a vertical maxillary excess. But there's points to know the size and the position of the maxilla relative to the cranial base. So that isn't something that can be modified if the patient is almost done growing or done growing. So that's a jaw surgery thing. I've done a case like that where they just literally shave the whole they cut the whole maxilla out, shave the base of it down, put it back up. They kind of change the angle of it. They put, what do you call them? Big plates. They drill them in, and then that's that. So that's that. Can't fix that. You could potentially intrude these teeth a little bit to minimize it, and maybe do some lip Botox to relax that lip, which looks like a hypermobile lip. And that's another point. Sometimes gummy smiles is just due to hypermobile lip. It has nothing to do with teeth. So you don't want to go finding one problem and then fixing it the wrong way, because then you're going to have other problems. So if it's hypermobile lip, this tends to settle down as patients get older and get out of their teens over time. But you can also throw some Botox up under the lip. I don't do that, but there's plenty of doctors that do. We talked about the airway problems, making the mouth and the jaws grow the wrong direction. And lastly, we've got mouth breathing, which is also an airway problem. If a patient has an airway problem, and they're breathing through their mouth either during the day or at night or both, you get a special kind of gummy smile. So this would be no big probings, no BOP, no plaque, no obvious VME, no issues in the ceph when you check the numbers, no hypermobile lip. This is, but you see kind of really gummy smile and really kind of fibrous tissue, thick tissue. That is what I call mouth breathing gummy smile. And that can only be fixed by stopping the mouth breathing. Stopping the mouth breathing may involve it may involve ENT surgery. It may involve expansion. It may involve just retraining. I mean, certainly I don't recommend doing this without an ENT okay or an okay from the pediatrician, but you can use something called mouth taping. Obviously, you're not using duct tape. You're using one of these ones that if there was an emergency and if you had to gasp in the middle of the night, it would bust off. It's not so sticky that if you opened up fast, it would pop off. They have nice mouth breathing tape that you can purchase from Amazon. And I wouldn't do it on a kid without an okay from a physician for sure. But you can put it on at night, and if they wake up and it's off, well, then they were mouth breathing. So if they wake up and it's still on, because once it falls off, you can't stick it back on. It just loses its stick. So that's a great test to see if there's mouth breathing. I mean, obviously, most of you can figure out if someone's mouth breathing. It's not hard. You walk in the room, see where they're sleeping, and see if their mouth's open. Occasionally, we all mouth breathe just due to a cold or upper respiratory infection, where that's just how you manage. But if you are chronically having allergies or chronically having nasal obstruction or mouth breathing to some type of obstruction, then you're gonna get these puffy, fibrous gums, which are gummy smiles, which aren't going to be able to be fixed orthodontically. You have to tackle the airway issue. It could be even more than any of that. So I highly recommend you go to an oral myofunctional therapist in that situation. All right, thanks so much.